Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Friday, October 18th. It is 5 p.m. And I am very happy, as always, that it's Friday. It's been a long week. Oh, boy. Okay, so we've been talking about some important topics this week. Looking in the toilet bowl. Yes, I know that sounds horrible, but at the same time pretty comical. But it's very important that you're paying attention to what is coming out of your body. Okay, so looking at your stool, looking at your urine to make sure that you are picking up on early signs that there could be something wrong with your health. Every time I go to see my acupuncture doctor, hello darling, she has me show her my tongue. Like that, okay? Now, I'm sure she is looking at it through the eyes of Chinese medicine, but in Western medicine, your tongue can actually tell you all sorts of things about your health as well. Yes, it is true. Hello, Susanna. Okay, so let's start out with what a healthy tongue should look like, okay? It should be pink. It should be wet, of course, and covered in small nodule-like bumps that are actually your taste buds, right? Okay, so that's the way your tongue should look. But if it doesn't look like that, then we need to talk. Okay, so, and you can Google this, like abnormal tongue appearance, and it's kind of bizarre, some of the things you're going to see, and some of them definitely don't do it before you're having a meal, unless you're a medical professional and you're used to seeing that kind of stuff. Hello, Marty. Because some of it can be kind of yucky to look at. So for me, if I were to see any of this stuff on my tongue, I'd be like, what the heck is going on? I'd be at my doctor's door immediately. But some people are in denial and they don't see it, they don't look, they think it's normal because they've had it forever, but it may not be. Hang on, I just got a notification on my phone. Okay, so number one abnormality that may appear on your tongue are white patches. Okay, it's often due to fungus or yeast infection. It's called thrush. Okay, it is related to immune suppression from autoimmune disorders or if you're taking medications such as prednisone. Okay, it may not be anything you can do about it necessarily, about it developing, but you certainly can treat it. Okay, so that is definitely something you should show your doctor if you have white patches on your tongue. Number two, it's called a hairy tongue. Okay, not really hair, but dark patches that look furry. I'm telling you guys, if you look this stuff up, you're not going to believe me until you Google it. So go ahead and just Google it, okay? Usually as a result of smoking, drinking coffee or other dark drinks, or poor dental hygiene. Okay, the hairs are not really hairs. They're actually bacterial growths that are caught or stuck within these bumps that you have on your tongue. Okay, so you can use a tongue scraper or your toothbrush to actually scrape them off. Again, you're not scraping off your tissue, you're scraping off whatever's on top. And then remove the causative factor so that they don't come back. Okay, so if you smoke, stop smoking. If you're drinking stuff that's very dark, that's causing this to kind of stain or develop that bacteria on your tongue, maybe it's not worth it, right? If you take antacids with bismuth, your tongue may turn black. It's very unsightly but harmless, but it will go away when you actually stop the medication. To me, if my tongue was black, usually it's eating licorice or something like that, but it's temporary, okay? But for these people, it's not temporary. It's around all the time. Number three is called a geographic tongue. It's actually patches of light and dark appear on the tongue. The smoother patches are actually lacking the tongue papilla, okay, those little bumps. It's an inflammatory condition that is very common. About 2 to 3% of the population in the United States has it. It's benign and requires no treatment. It also can show up when your immune system is kind of doing something funky. So my daughter used to get this every single time she got a cold. So if she started to get sick, she'd stick out her tongue and there would be these little patches of, it looked like a map on her tongue. So she, poor thing, could never fake being sick because it happened every time. So there was no faking for her. Oh well. Okay, number 4, a bright red tongue or a strawberry tongue. Okay, so it looks like strawberry with those little dots. Okay, it's associated with few medical conditions, including vitamin B12 deficiency and iron deficiency. There's other rare disorders that can cause it, but again, like I said, they are rare, so don't go chasing zebras. Most likely it would be something more common. Number 5, a burning feeling on your tongue, like you scalded your tongue or you drank some boiling hot water. Or hot coffee, I should say. It may be an allergic reaction to your oral care products, so something to consider. Hello, Glenann. So some health problems like a dry mouth, acid reflux, and even diabetes can do it as well, and even foods such as pineapple or spicy, very spicy gum. Okay, so again, if you remove the causative agent and it goes away, you can go back to it if you want to. At least you know what caused it, and there should be no concern. Number 6, a smooth tongue without any bumps at all. It looks glossy and red. This can indicate nutrient deficiencies such as iron, folate, and other B vitamins. Number 7, bumps or canker sores. We've all had a canker sore in the past. These are small, painful, reddish bumps that come and go. They're common with viral infections and spicy foods. If one is persistent, have your dentist or doctor take a look at it, just so that you can make sure it's nothing to worry about. And lastly, number 8, a fissured tongue. Okay, deep grooves, cracks, or clefts that can become more pronounced with age. About 5% of the U.S. population has it, so it's also can be benign, but it can be linked to autoimmune conditions as well. So that is definitely something to take a look into if you're having this and you never had it before, or you've had it and you never knew why you had it, okay? Any sores or changes to your tongue that don't go away in a day or two might need to be looked at. Remember, your oral mucosa in general turns over, changes from, it basically, I don't know how to say it, it sheds, if you want to say it. So it regenerates is a better word, every 3 days. So in 3 days, anything that's happening in your mouth, if it's not gone, and it persists for longer than that, especially 3, 5, 7 days or longer, definitely something to look into. So we did a lot of talking about things this week that I'm hoping you guys take a look at yourselves, look at your health patterns, your bowel habits, your urinary habits, and make sure that you are aware of what's going on, what's going in, what's coming out, because it can really indicate health issues and you can catch them early. So on that note, it's a wonderful Friday. I hope you guys have a wonderful weekend with family and friends. And I will be back on Monday for another Live in 5.